Yeah. Okay. Fatima, can you say
Hello.
something? Yeah. Okay.
Excellent. We can hear you now, Jannat.
Yeah. Okay. It's live
Perfect.
now. Just ask her to start the show.
It's not on yet.
30 seconds. It will be on in 30 seconds.
Hello, can you hear me, Jannat?
Yes, sir. Can
All
you
right.
hear me now?
Yeah, I mean, I can hear you very good. Good. Let me just check who's here. Hi. I'm gonna check with the folks. Can they hear us?
Yeah. I restart the whole stuff. So it should be on.
Say now if you can.
Finds that there is a
What do we do with
plausible
this?
It's
case
on again. It's
that
on now
Israel
again.
is
So
committing crimes of genocide and
you are
sends
on
Israel
now
for
again.
trial on
You are on.
Just bear with us 1 second. We're just gonna get our footing together. Still, some of the stuff needs to be adjusted. So the team has been working pretty good. Can you hear us? Can you hear us now?
You said it disappeared.
No, it's coming back.
It's coming back.
Please. Yeah.
Yeah.
You are on as well.
Okay.
How does it show
Okay.
like this?
Perfect. I think we're on now. Is there gonna be a bit of a lag?
Yeah. A bit lag. Thank you. So you need to mute. You need to mute here. Sorry, mute here. Yeah. No.
So,
You can start to start now.
hi everyone. Can you guys hear us? Now they can hear us. Oh, haha! Finally we're on. I'm very excited. Thank you, Jeremy. Thank you. I think that's great. Let me just say, there we go. I want to make sure my team is on so we can start. Thank you for everyone. Sorry for being a few minutes late. Good. I'm glad. We're just gonna start now, and this is really exciting. So, as you guys know, we're just huddling up together for our, our weekly meeting. Fantastic. I see all of you very ready for the meeting. All right. Yes. That's very nice. Okay, so first of all, let me just say thank you very much for all of you for your patience. I know we're a few minutes late, but we want to start now. And let me start off by saying, look, we're still a little bit experimenting with a few things, so every week it's going to get better. Um, Today, we have a very interesting topic for you guys, and for that, we've asked the help of Dr. Jannat Malik. Dr. Jannah is a MBBS from Rai Medical College. And then she had done her matriculation and other medication from Islamabad. Currently, she is the virtual sleep liaison at Texas Sleep and Therapeutics. So she's doing a brilliant job there, I know for sure. Dr. Jannah has done her house physician job at Sargodha DHQ Hospital. Um, and now she is, I know she's a mother and works with us with the team here in the sleep, and she's going to be talking to you guys about a little bit about diabetes. So let us start with this discussion first, and then we'll I want you guys, while you're listening to this, put in any questions, any doubts there, because we very closely can hear. We want to make this an interactive sort of thing. So the next 45 minutes should be just like an interactive discussion. I know quite a few of you have joined already, and I can see. So let's just start without any delays. Dr. Jannah, please.
Okay. Hello, everyone.
Hi, welcome, Mr. Jannat. Your voice is fantastic. It's very loud and clear, right?
All right. All right. So the topic of today's discussion is diabetes mellitus. So as you all would be familiar with the term already, so we can go on with the introduction first. So diabetes is a chronic condition which affects how the body processes glucose. So glucose we already know is a type of sugar, and diabetes is a disorder of glucose metabolism. So when you have diabetes, your body either does not produce enough insulin or it doesn't use the insulin effectively. And insulin is a hormone that helps regulate the blood sugar levels in our body. And if we don't have insulin, this can lead to very high levels of sugar in the blood, which will ultimately result in a condition called diabetes. So let's go over what different types of diabetes first. So diabetes type 1 and 2 are the main types. And type 1 is basically an autoimmune condition in which your body's immune system mistakenly attacks its own cells. So there is an organ in the body known as pancreas. So
Jannat, can I
the
ask you a
cells in the pancreas.
quick little question? Do you think your
Yes.
mic is near you? Your voice is breaking a little bit. Are you using your headphone or is it just like is it
No, sir, not headphones, but is it breaking up? Maybe it's.
just a wee bit breaking up? Yes, we heard the bit where diabetes. You just did the intro and then it just broke up a little bit. So let's just start again and see what you.
Okay. So you can hear me now properly?
I can hear you properly. Very good.
Okay, okay. So let's go over the main types of diabetes first. So the main types are diabetes type 1 and type 2. So type 1 is an autoimmune condition where your body's immune system mistakes its own cells. So there is an organ in the body known as the pancreas. So it is the main organ that produces the insulin in the body. So when that organ does not produce the insulin, there is a deficiency of insulin in the body. And in type 1 diabetes, your immune system attacks the cells which produce the insulin in the body. As
Mm.
a result of which there is an absence of insulin, and it results in the condition called diabetes mellitus type 1. So this condition basically runs in the genetics, and most of the patients it is diagnosed in the early childhood. And during the part of the life, the patients are completely dependent on the exogenous insulin.
Okay.
Okay, is my voice clear?
I think it's about 60-70% clear. Yeah.
Okay.
I'll let you know. I'm gonna have to probably summarize a little bit. So go over your types and then I'll summarize. I think they can probably hear my voice a little bit clearer, and it's. But let's just go over the types and then you can help me out a little bit, okay?
Okay. So let's discuss about type 2 diabetes. So type 2 diabetes basically is a condition in which there is a presence of insulin in the body, but your body becomes resistant to the effects of insulin, which means that the insulin would be there, but your cells cannot utilize it. As a result of which, glucose is not enter the cells, and there will be high levels of glucose in the blood. So this type of diabetes is mostly associated with the lifestyle factors, like it mostly occurs in the patients who are overweight, who have a sedentary lifestyle, and who have a poor diet. And this type can be managed through the lifestyle changes, oral medications, and sometimes the insulin injections also need to be given. Okay, let's discuss the symptoms of diabetes. So when it comes to diabetes, there can be short-term effects on the various organ systems, and the main symptoms that patients are going to experience are going to be polyuria, polydipsia, and polyphagia.
Mm.
Polyuria basically means excessive urination.
Let me
So
help
initially the
let me
patients are
help a little bit because I think your voice is now completely breaking up a little bit. So I think it may be a few things, but we'll just try to coordinate this a little bit differently now. All right. So I think what Dr. Jannat is first of all talking about is what are the types of diabetes. All right, the types of diabetes, and that's very important. Let's just go over with the group what are the types. So what did you guys hear? I hear ya. No, I understand the voices. Okay, so she's saying there are two types of. There are two types. Basically, sometimes they say there are even three types, but there is a type 1, type 2, and a type 3. Let me ask a question. What do the majority of people have as a diabetes type? You should all know this. Do they have type 1, 2, or 3? Yeah. Type what? So do we have type 1 more or type 2 more? Yeah, let's just keep that out. Do we have more type 1 or type 2? I know you all are saying type 1 and 2. But generally there are two types, but there is a third type. The third type is called gestational. That's more like during pregnancy. All right. So do we have more type 1 in the general population or type 2? Okay, so let's ask another question. If most of you think it is type 2, why do we have type 2 more than type 1? That's the main question. Well, now there is a perfect, love it. You all are saying, okay, everyone has type 2. But Jannat just explained, and I know it's a little bit hard. Why do we have type 2 then more? Type 2. Why? The question really is why type 2 is more than type 1? Right, Jannat? That's a valid question, right? Why is type 1 more than, so type 2 is more than type 1? Or the other question, very good, we get something and an answer here. Type 1 a lot of times can be well, let me take that a little bit back. Lying condition that is precipitating it, and it results sometimes in the complete destruction. A lot of times it's complete destruction of what? What does it result in complete destruction of? Insulin. So a lot of times there could be any, in this case there is an autoimmune disorder, but it could be hereditary. But insulin for some reason is not produced at all, 0. And it just disappears. Whereas type 2 is a lot of times an acquired condition. Why is it like an acquired classically condition? Type 2. What do the vast majority of, let's just say, what is the vast majorities of Pakistanis have? Or even Indians. Let's say India, Pakistan, subcontinent people. What do they have? Which type do they have? And why? Jannah, help me out. Which type do they have? Because let me ask them. You could see, if you go to the tube, you see what type do we have, like we have background Pakistanis have. Type 2, yes, okay, that's perfect. We have type 2, but why do we have type 2? Why? Is it because of what? Okay, that's one cause. Someone said obesity. We're fat. How is that? So very good. Two good conditions have come in. We're saying where was fat? Dad was fat, or mom, or is it more like we're sedentary? Very sedentary. So two precipitating factors that result in insulin resistance. The insulin is there, but now either it's become resistant and or is produced or ineffective. So it's all about the game right now of diabetes is, you're gonna think of insulin. Very good. Momina said a very good point, and I like that. If you have too much fat and cholesterol in your body, the resistance of insulin becomes higher. Okay? We need a lot more insulin to metabolize our glucose, and a lot more is being converted even from fat. Fat eventually gets converted into sugar, and excess sugar gets converted into fat. So vice versa, they're both related, right, Jannah? Do you think you agree with that a little bit?
Yes.
Yeah, right. That's so. We're in layman terms, we're saying it's a problem of. So, Momina said a very interesting thing. How is then the diet playing a factor? Why is the diet an issue? Is it diet an issue, or something else? What's the issue? Are we saying we're eating too much, or are we saying it's because whatever we eat, we're just not mobilizing it, and that's why we're having type 2 diabetes? Which one do we think it is? Which one do we think? So a lot of we think it is. Oh, very good point. Someone said we have a bad schedule as well. That's interesting. Or we don't have a good routine. That's very interesting. Routine is not good. So we have a problem with, and I like that. We're saying we're too lazy, we eat too much, and then we sit. Okay? And that's a problem. Is that the case? Lifestyle? Our lifestyle is not good? So let me ask you this. I can tell you just generally from eating habits, okay, just eating habits. Do you think there is a difference between us eating, Indians eating, Chinese eating habits, and here in Americans eating habits? So let's just look at eating first of all, habits. Is that an issue? Who thinks that all the different, or is it a culture? Is the culture a problem? Our food is a problem. The type of food, is that even an issue? Or because I want to ask, I have Jeremy here in the studio with me, and I want to ask, Jeremy, do you eat biryani? Do you know what biryani is?
Yes, it's the Mexican.
Oh boy, tell you,
no,
Jeremy,
it's
not Mexican. No way. You've had that biryani three, 4 times.
Yeah. It's the chicken biryani that the ladies provide to me. It's really good. It's not sweet, so I think it's good for the health, but not the rice. I think the rice might cause the diabetes, right?
Right. So we think our food is very, very, very tasty. We make food for taste. That's what we do, just generally. And we live for food. Oh, I see another comment there. We live for food. I see a Lebanese food comment. Is that because someone thinks Lebanese food isn't tastier? But I can tell you this. Just Jannah, I want to tell you this. You know, I went to England last week, right? And I came back, right, this week, and I weighed myself, and in 10 days I gained 6 pounds. Jannah, I gained 6 pounds in 10 days. You know why? Because where we lived, first of all, my Bobby made sure that I eat paratha every day. And I could not say no to her. That was a problem. And then I went out, and then we had Nirala. Well, there is Nirala there as well, but there is Ambala Mathai as well. I don't know if you guys know in London, but it's very good. There is actually a Nirala as well. And I think I ate. So just in, Jeremy, 6 days, I think I gained over, well, 10 days, I think I gained about 7, 8 pounds. And yet I was still trying to go to the gym there, still trying to do a run, but my diet became suddenly so heavy. And I tried to cut back. Let's listen to this. There is a very good saying that if you eat a heavy meal, skip your next meal. That's a good strategy. So if I eat a heavy meal once, I skip my next meal. But when I was there, I think even if I skipped 2 meals, it was not enough. So because it was very rich food, and I can tell you, so if you have a culture like that our food is become very tasty. It's very heavy. Someone said it's a cholesterol, too much oil. What do? How are you? The Jannah's question is going to be, I know she's saying, oh, there's a lot of resistance. And we're going to talk about this because she touched on diet, poor diet, lack of activity, and overweight. That's her main slide. And I think it's brilliant. So what do you do? By the way, I was reading a book. It's called forgot Chinese diet or something. And the newest studies are that the new generation of Chinese are also very obese compared to what they were 50 years ago. The newer ones have a lot of diabetes now.
Yeah, we like fries.
And one of the biggest player in changing your culture, I'm going to say Jeremy's culture, is, guess who gets the credit? McDonald's.
Yeah.
McDonald's gets the credit.
Yeah.
So more diabetes with that. Now, yeah, Chinese don't eat too much. That's true. There's a lot of people saying, in fact, the Indians also measure their portions, and they eat little portions. And in the instance, just overall, the prevalence of diabetes in them is much less compared to our. So the amount does matter, right? What we eat, right? So the amount is also very, very important with this. So just know that these. So that's why we guys have to know a lot about diabetes just in general. All right. So let's move on to the next little side. So I think the important things was the diet, the culture, and then we know what the diet culture is. I think that's relevant, and also what we are eating, because I don't know how to resist the food. It's very, very hard when you have food like that. Okay, well, let's listen to what next bit, Jannat.
Okay, so let's discuss about the symptoms of the diabetes. So initially, the patients are going to experience polyuria, polydipsia, and polyphagia. So what is polyuria? So that is basically excessive urination. Patients are going to experience the symptoms when they are having high blood glucose. So the next thing they are going to experience is polydipsia. So since the body is excreting out a lot of water, so the patients are going to experience increased thirst. And since the body is not utilizing the glucose, which is the main energy source in our body, so the patients are going to experience increased hunger also. So these are the three basic symptoms that are going to, issue in the patient: polyuria, and polyphagia. So even we can have other symptoms that can involve the other body symptoms. Patients can present initially with symptoms of neuropathy, which can be the numbness and the in the hands or the feet, and the patient can experience symptoms which can be related to the rapid heartbeat and palpitations. Some patients have hypoglycemia, and then the patient even end up in the emergency department with symptoms of nausea, vomiting, or stomach pains. So this also happens when they have all those cells in the body. So the elderly can present fungal infections. So these can usually present in the skin folds of the skin, like in the groin area, under the breast, and even the skin can be really dry, and it can also cause slow healing of cuts and
Okay. Well, let me just
sores. These are
hold
the
there.
basic symptoms.
Yeah, let me just hold. Sorry, Jannah. So let me ask them. Well, very good. I just asked. I wanted to ask them. So what do they think is the most important symptom? Yeah, just bang there to say polyuria, polydysia, poly. So what is polyuria? What is polyuria? Polyuria. I think the docs all know. That's fine. What about what is polyuria? Polyuria. Jana, meanwhile, check if you have a headphone. I don't know if you're on a headphone. If you have one, you may want to try that. Because I don't know if, are you speaking from a mic or what are you trying to use, Jana?
Yes, sir. Let me try a headphone. Just
Yeah, I think the headphone might try that, and I'll speak to them. Look, guys, it's frequent. Don't say excessive, increase. You go to the toilet a lot. Give me some. Can someone give me an idea? How many times do you go? Let's say, okay, all of you are saying frequent, excessive. Fine, I believe that. So if you have subtle diabetes, or one of the initial signs, you go to urinate a lot. What do you think, Jeremy? How many times do you go to the how many times do you think you go to the toilet? And I'm hearing everyone else is there as well, right? How many times do we think we're going to the toilet? Give a number. Can someone give a number? How many times are we going to urinate? Some say frequent. But then others may say, well, I go up once or twice during the night anyways. And then how do I know what is frequent? Is that frequent? And I go once, twice during the day. So are we saying more than 5 times is? I'll tell you another thing. If I drink a protein high shake, I have protein, I will urinate more. Or if I have a diuretic, if I take a diuretic, I will urinate a lot. So what is frequent urination? Interesting. So this is say we're not going more than 4 or 5 times. And if I tell you, if you have diabetes, you should be hitting up to 8-10 times during the day. And you go and then you come back, and at night you're frequent urination. You're doing a lot. It's not just 2, 3, 4 times, 5, 6 times in 24 hours. You easily in 12 hours are going 8, 10, 10, 12, 12, 14, and even more. If your sugar level is high, you will be urinating a lot more. So if your sugar is in the 300s, 400s, you'll be bloody going every hour, every second hour maybe. So that's not like just going just a few times. Yes, you go. So keep that in mind, that all of a sudden you're urinating a lot. You think, and it's not like a poor stream. You urinate out all the sugar that you have drank. In fact, I want to bring this to your attention. Your urine is, how does it normally, well, I don't want to be too gross, but let me just say that animals, your urine becomes very sweet. Right? Does that make sense? Why would it become sweet?
Too much sugar.
It's too much sugar in it. Yes. It's not normally, the order and the taste is not like, not that I've tasted it, but I'm just saying that's how it is, right? Unless it's infected. Infected urine can still have all those urination frequency, right, Jannah? So that's the second point I want to bring out. Polyuria, urination. But someone is saying besides polyuria, right? What is the other thing is happening when you're doing that? Is why are you? The word that we use is polydipsia, and you will see that's the second. Why are we drinking more, guys? Why do we, Jannah? Why do you think we're drinking more? Why if we've urinated all the sugar out, why are we drinking more? What do you think, Jannah?
Yes, sir. Can you hear me now?
Oh, it sounds better, I think. Have you connected?
Yes, sir. I connected the headphones.
Oh my God, you're back, Jannah. Welcome. You sound different now. Go on.
Okay. So we are polydipsia. So polydipsia is increased thirst. So why are we experiencing the increased thirst? Since the glucose levels in the blood are very high, and obviously glucose this has to be excreted out of the body. And when glucose goes out of the body, it takes water out of the body too, and that is why we have increased urination. And when the loss of water from the body is increased, obviously we are going to be more thirsty.
Good girl. Yes. Very good, doctor. That's a brilliant explanation. We're we're actually um, drying our body out. This is not, we're actually squeezing water out of the cells and we are drying ourselves. Even the thirst cannot keep up with it. So that's no that yes, and that's what someone has said, that there is dryness in your body. That's another sign. Once the body becomes dry, that's when it's prone to infection. If you start getting infection, like Dr. Jannat was saying earlier, that's why you can have infection. What is the commonest area that has infection in diabetes? Where? What are the areas that we worry about? No one's had a patient with diabetes, or no one has mom, parents, or anyone with diabetes. What are you start worrying about? Very, very good, Faiza. Very good. This is saying like, oh, it's the feet. Yes, you can have other infections, but the feet dry out even more, and the nerves get affected to the feet, and hence they feel less, and that further exacerbates and having issues with infections. And the nails and the toes, they cause what is fungal infection, fungal feet, right? So they're very prone to have that. That's also a little bit of an issue, all right? So I just want to bring that to your very good, Jannah. So come on, let's tell us a little bit more, doctor, about the diagnostic criteria. We'd love to hear that, right? I think you all got it. Yes, the kidneys can be affected. Someone's pointed that out. The kidneys start going into relapse because they have now dealing with a lot of load that is going on, and the glucose does get deposited in the kidneys. It's got a lot of glucose going through, a lot goes out, but some stays in on the kidneys, and it starts causing the process of microalbuminuria, which we'll touch on later on. That's why kidney failure is an issue. Yes, kidney stones is an issue as well. So it is very, very, that's all sort of enticed in and relevant. Okay, good. Come on, let's keep Jannat. So tell us a little bit about how. Let me ask the people first. I mean, I know the slides are here. Let me ask them the question, and then you can tell us. How would we know that we have diabetes? How would one know? I know you look for the signs and stuff, but I check my glucose, and the level is, let's say the level is 150. Do I have diabetes? I check it now. and my level comes 150. Do I have diabetes? What you guys think? No one wants to say yes or no. Very good. Faiza is on fire. Very good. It's Faiza thinks it's normal. What about anyone else? I know you guys want to bring hemoglobin A1C. I hear that, and I just ask a simple. I have 150. Aisha thinks yes. Fatma thinks no. Mariam thinks no. Shanza thinks no. Abdullah thinks no. 120 is normal. That's the main question. Is first of all you gotta know what is, if I have a 150, the next question you gotta ask me, doctor, is it fasting or random? Did I just pick it up? That's the main question you gotta ask, and that's what Dr. Jannat's slide is gonna tell you about that. 150. If I say my level is 260, do I have DM? Forget about now 150. Let me just say 150 is now. Yeah, there you go. Yeah, the Hisberg, right, peaked 400. That's the question I want to hear. 400s. So if I have 260, yes. Am I diabetic now? Who's gonna say yes? And who's gonna say no? So Jannah, that is what you're gonna explain to them. That's what they want to know. When am I diabetic? Because you guys, you're in the medical field, and then these are basic things I think you guys need to know. We got over the symptoms. I know you could. Besides the polyuria, polydipsia, someone said dysphagia, someone said you could have infections, someone said you could have eye problems. Eye problems is also very big, and you have to check your kidneys. The second question you gotta ask is, what's your fasting glucose level should be, and what your random glucose level should be. Those are your two main questions. If someone says, Zalika said 400, we know that it's already there is a diabetic patient. But that's very the difference between a fasting and a good. So Jannah, have you got that slide? Would you explain our team that?
Yeah.
Go on.
Okay, so first we have to keep in mind that these blood tests for the sugar are done usually. The first thing could be that they are done randomly. So for the random blood sugar, the normal levels are 110 to 140 milligrams per DL. And if you have a blood level that's greater than 140, it means that you are in the pre-diabetic category. And if you have the levels which are greater than even 200, then it could be an indication that you, with further testing, you could be tested positive for diabetes mellitus. So you also need to do some other tests to make a definite diagnosis for the diabetes. So the other thing is that we need to do the fasting blood glucose levels. So this means that the patient needs to fast for at least 12 hours, and then we are going to do a blood test on them, and if it shows a level that's greater than 126 milligrams per DL, then you can be tested positive for diabetes. It means that you have the condition.
Oh, brilliant. That was brilliant, Jannah, because those are the two important things. Know when are you testing. If you fasted 8 hours, right? And you check your glucose, and if it is not less than 120, you have by definition diabetes, and the American guideline is you need to check another time. So generally you do 2 level checks, okay? And how long, the question is, how long do you need to fast? How long at least you need to fast? And the second question with it, do you need to fast just food? Do you have to fast for a while? And is that sufficient? Let's check the first one. How long do we need to fast? So generally 8 hours is enough for American guidelines. I know Jannat said 12, but and then do you need to do both or one? Both or one? Meaning, do you need to just fast for a lot? What do we think? Dr. Noor said just food is enough. You can drink, right? As long as we don't drink beer or something. Is that what probably Dr. Food only? Okay. Aisha says food as well. So yes, we can drink water. Very good. I think the point being that water does not affect. You don't have to do a complete fast. You know, Jeremy, when we fast, Ramadan is coming, we do a complete fast. We from sunrise to sunset, and our fast is going to be at least 14 hours. And in that 14 hours, we don't eat or drink.
No water.
No water. And that's why it's very relevant to us. And sometimes the people think that if I do that, I should not even take a blood test. If they take my blood, my fast is broken. That's also. Is that true? If I ask that, is the fast broken if your blood leaks? Let's see how many mufti are there in our group. There's also there's a fast broken if you have a blood fast. Oh, we have a 50-50 Sharia here. Some are saying if the blood leaks, let me ask you another question. I want to ask this because she brought it up. Binish brought it up. Can a diabetic person fast? If yes, and his symptoms worse, is he allowed to break his fast? I want to ask a question. That's a second question. Diabetic person can, let me just slow down here because I want to see. Some are saying yes, the diabetic person can fast, and knowing if the symptoms get worse, he or she can break the fast. Okay, I like that. Okay, if you, all of you, what symptoms allow you to break fast? What symptoms allow you then to break the fast? This is very timely, because when I was practicing, I had a lot of these questions and issues. And this question comes up every single time from my patients. Oh, I don't want to get an injection. My rosa is going to break. I'm going to die. So my question to them is they all agree that when you fast with diabetes, you're allowed. And they said if your symptoms get worse, you can just break your fast. So my question to them would be, well, what is the symptom that would make them their fasting, they break their fast? So let me go through what is the answers I've had, sir. Some are saying depends. I don't know what I'm asking. Some are saying it should be a life-threatening. So what is life-threatening in diabetes? That's the question. Everyone agrees with that as well. That's a good one. If you vomited and have low blood pressure, that your glucose level is the glucose level is so here's the question. Do you check your glucose level? If I say do you with fasting, are you allowed to check your glucose level? Because it will answer the first question. Are you allowed to prick and get the blood out and check?
I think yes.
But they're half and half. And they're saying, some are saying you have to wait till you faint. I agree, you should not let your glucose go below 50, guys. Hello, everyone. No, it should not. So my question is to you, how do you know it's not gonna go below 50? How do you know without checking? Can you check your glucose without checking the blood that comes out? So can the consensus be, so because I know you guys said no, you're not allowed to have blood out, rosa is broken anyways. So if I have my first symptom and I want to check I check my glucose, and I said, Jeremy, I checked my glucose, I had a headache or something, I'm not feeling well. I have that, by the way, during Ramadan, the first few days, my first 3 to 5 days, okay, 3 to 5 days, I'll tell you all, don't speak to me.
Feel angry.
I'm angry. I have headaches first.
Yeah.
So my first few days, I have a lot of headaches because that's probably caffeine and all that stuff going out of my system. And my last 10 days, I'm more angry. I probably am properly angry because I haven't ate. And it's a tough time because I can't speak. I don't speak. I see things around and I don't want to say anything. I'm not in the mood. So you have mood disturbances when your glucose level is not at where it needs to be. And that's very common as well. So if I'm having that, should I check if I had diabetes and I do a finger check? Does that mean my fast is broken? Does that mean now my fast is broken? I love your symptoms, but how am I gonna know? And if I have a symptom and I'm not allowed to check my fast, is it broken? Absolutely. Shajabai, last days are very tough for me as well, I can tell you. Absolutely there are. So now you guys are saying if blood comes out, then fast is not broken. What about if I feel nauseous, but I don't vomit? Is my fast broken? I want to know from you guys because you, mashallah, all of you are pretty mullah type. You know, you've got the consensus. I want to ask. Or if I vomit, is the fast broken? Okay, so the nausea not, but vomit. If I vomited, is my fast? Are you guys sure? That's not what you said in the beginning. All you guys said, if you vomit, your rosa is broken. So, well, there, and then we have a Lebanese mufta Alma as well. She says yes. Majority of you are saying no, and with blood you are saying no. So you ask, and then you ask. Everyone have their, and then the other interesting thing is, Jeremy, with this, all of us have our own imams. Jannah, who do you go to? You have your own imam for guidance? Yeah?
Yes, sir.
Yeah? Who do you go to? Is there anyone specific you like going to? I have my imam online right now. He more or less would adjust to my demands a little bit.
So normally if I have any questions related to Sharia, I go to islamqa.com.
Yeah. You think they all have these they will have these answers for our team here? Because
Yeah, they do have all the
a lot
answers.
of people say vomiting won't break and blood won't break. First they said that it does. Now some of them are saying yes. If you vomit even a little bit. My question would be, what about if I retch and the food? Here's the other complication a little bit. Sometimes you vomit. You know, this happens. You vomit out, and I understand. Actually, when you start vomiting out, and if you're diabetic, that's a bad sign. I think just human-wise, you should probably consider breaking your fast, having it properly checked, and sorting it out. I think that's not only a medical response, but a religious response. If someone wants to wait and open a fast later on, I would, and then he or she is doing all right, and you've checked everything. I don't know who am I to say yeah or nay and force someone. So we can perhaps have this discussion. This is very relevant, the diabetes, because believe it or not, even though I'm not a mufti, the diabetic patients, a lot of our patients will ask these questions left, right, center. You guys should know a little bit. So let's just go on with your other diagnosis, because I want them to know, I want them to keep these things in mind. They will remember that nausea, what is the most feared complication for anyone and a medical doctor, or you have parents, if they have DM? What is the most feared complication? Let's get back to medicine now a little bit. What is the most feared complication? Feared complication means if you have a loved one who is diabetic, what are the thing that can kill them? All right, I'll give you options because it is a little bit tough. Four choices, okay? Four choices. I see that. Okay, let look at this again. I'm giving you four choices, all of you. A heart attack, a stroke, kidney failure. There is something called DKA, it is called diabetic ketoacidosis, and hypoglycemia. Hypoglycemia is low sugar.
This one.
Okay?
Yeah, I think it's this one.
Yeah?
The hypo.
What, right? Let's see what so your team are saying. Kidney failure is the most feared one of the feared ones for even the doctors. What can kill you instantly is the one. What can let me ask another one. Okay, let me ask another question. Amongst our group that we have, who has looked after parents or family members with diabetes? Who has? Just say yes if you have. I know Zalika said she has looked after her team member, a family member. And Tyra has. Okay, so we have a few people who have looked after. Yes, I see now a few people. Correct. So what is the... Okay, let me tell you this. Last time, not this time, last time I was flying to American Airlines, and they call, this doctor on board. So I step up and I go. It's not a good situation, because when the plane is on an altitude and you don't have anything with you, no stethoscope, no apparatus, there is a kit. They open their airplane kit, and when you look at the kit, you don't know anything about it. Everything is confusing. So I had a patient, and guess what happened to him? He fainted.
He just passed.
He just passed out. And luckily, at that time, even though I stepped out, I had a nurse on the plane. And she came along and she said, well, come on, doctor. And we both looked at the patient, and I just tried to slap him and tried to wake him up. And he just wouldn't wake up. And he looked very dry. And I tried to do a blood pressure, and I couldn't get any readings. I checked his pulse. He had a pulse. And then luckily in the end, when we start looking at, we checked his glucose level.
It's low.
And you know what it was? His glucose level was 30. And so, I didn't know if he had a heart attack. I didn't know anything. But if he had stayed low, he would have died. And he took some medication with his diabetes medication. So identifying the hypoglycemia, those patients, if you're looking after them, you're always worried about their sugar levels going down, because they can die. They can die. And all you need to do is give them some
The
juice.
sugar water.
Juice.
Yeah, juice.
And it starts coming back up. That's all. So that's why doctors get in trouble if you don't pick that up in the thing. They also American Air Stewards is there, and they're all trying to diagnose. And I did the least, even though I think the nurse put the finger in, and she got the glucose level, and that confirmed because he could have had a heart attack, he could have had anything, could have fainted from anything, but fainting from medication is we just any. So you want to give? That's a very good question. What type of juice should you give to your patient? Generally, the orange juice is sufficient. Any with a little bit of, but orange, apple, or any would be enough, and that is suffice. Checking these patients with their knowing their medication is very important. But if he's traveling alone, it's very hard to do get the diagnosis.
With the coke,
So, but
coke?
hypoglycemia. Pardon?
The coke.
The bottom line is give them whatever you have. Now, if you just give a diet coke has 0 calories, that's not going to do the job, right? You want to give a bit of calories to them, bit of energy drink, so they can perk themselves up. In about 2 hours, 3 hours, he was sitting, he was talking, he was comfortable, and he had a weird history. Me and the nurse thought, but yeah, you could. But the juice is easy to drink. Candy, chocolate, and everything are hard to chew and digest at that time. And especially when you faint out. You faint, you don't know. If you have a person who's fainted, the only thing they know is open their mouth. When you put something at the back of their tongue, they will swallow it. But chewing or doing is dangerous a little bit because it can get stuck at the back. So that's the little message and the story that goes with that. With Jannat, your little talk. Sorry, dear, I've interrupted you a few times, and we're still on the diagnostic. So go on now. I think you got good speaker. Let's go with the diagnosis quickly, and then if anyone's got any questions, keep on writing them here, right? So we can answer. Me and Jannat will answer them. Let's do the next diagnostic thing.
Okay, so we have discussed about the
Next.
fasting glucose levels. The next thing we can do is the oral glucose tolerance test. So this one is also called as the glucose challenge test. So in this, the blood sample is usually taken after the patient is given something sweet to drink, and a blood sugar level greater than 200 milligrams per dl on two different occasions would indicate that the patient has diabetes. So the next step is going to be the hemoglobin A1C test. So since you have these patients always have high levels of glucose in their blood, and hemoglobin, as we all know, it gets attached to the glucose and it forms the hemoglobin A1C, which is also called as the glycated hemoglobin. So we usually measure this level for the patients. If this level is greater than 6.5%, it indicates that the patient has diabetes. And this test can also give you a measure of how the patient's blood sugar levels have been over the past 2 to 3 months. So if these three tests are positive, then the patient is tested positive for diabetes mellitus.
Very good. Okay.
Okay, should we go on and discuss the risk factors for diabetes?
Sure. Let's do that.
Okay, so we have to figure out like which are the people who are much prone to this disease. So the first thing is that everyone who is more than 45 years of age, they need to be screened for the development of diabetes. And the second thing is that everyone who is obese, who have a weight greater than 1% of their normal body weight, they also need to be screened for the development of this condition because obesity it creates the insulin resistance, which we have already discussed before. So the cells they're not able to take glucose properly. So obesity is a condition that can contribute to the development of diabetes. And the next thing is that family history is very important. So type 1 diabetes has a very strong genetic component, and even for the type 2 diabetes, the component along with the environmental factors, it can contribute to the development of this disease. And the next thing we have is the hypertension. So next thing we will discuss about metabolic syndrome. So that is also a condition that includes three things. One is the dyslipidemia that has been increased level of cholesterol in the blood and the hypertension. So these conditions can contribute to the development of diabetes. Everyone who is hypertensive, who has their blood pressure is greater than 130 by 80, they all need to be screened for this development of diabetes.
Very good.
And there's the next thing with that we have is the gestational diabetes. So this is a transient state that usually develops in the patients who are pregnant. So normally it will resolve after delivery of the baby, but anybody who has a history of gestational diabetes, they usually have more tendency towards the development of diabetes later on in the life. And the next thing is the polycystic ovarian syndrome, which is very common in today's world. So this is also a condition in which we have a lot of insulin resistance developed in the body. So anybody who is diagnosed with PCOS, they also need to be screened for the development of this condition.
A lot of people have diabetes, right?
Oh, okay. Should we go on and touch a little bit upon the effects on health on different organ systems in the body?
Yeah, so we can do a follow up on this. I think we're already over an hour. I don't know if does anyone have any questions so far on this? Mind you, we haven't covered treatment, etc. so far. But does anyone have any? Yeah. When the so one of the persons has a question like, if your sugars level are up in the 400s, what should you do? Jannah, sometimes they say their parents' sugar levels just goes up in the 400s. What food should you avoid? What should you do? Jannah, what's your thoughts? We got quite a few doctors, so anyone can chip in and write an answer. But Jannah, what's your
I think
thought?
the first thing they should be doing is that they should be avoiding anything that's sweet. So we have now a lot of alternatives to the sugar. We have stevia, which can be used as a very good alternative to sugar.
Yeah.
So that is mostly used for the diabetic patients. And obviously, anybody who has their levels greater than 400, they need to be screened regularly and they need to be compliant with the medications.
Mhm. You know, one of the things that is very ironic is when you have diabetes, you want to eat more sweet. That's because you're told not to eat sweet. You end up eating more sweet, and you love it more, and it's very hard to resist when the food is so tasty and you're used to it. So, and you bring up a good point that you should definitely be on sweetener or substitutes, and then so that's very relevant. The second thing I want to bring point out is right now you guys are going to come very soon on thing is called plant-based food, and please go and have a look at this. There's been a lot of new studies out there, and a lot of them, the last one that I saw was from San Francisco. What is plant-based food? Actually, you're going to eat chicken. It's going to taste like chicken, but it's actually made from plant. So in my fridge right now, I have chicken, I have meat, I have beef type food, and I have sausages, and all are made from plant-based food. Now, it doesn't necessarily mean that their calories are less, but definitely some of the ingredients are different. So that's going to be one new thing that I think, yes, they're meatless burgers. They're without the actual. In fact, those who want to eat pork can eat plant pork. Okay, it's plant. It just they mix the food in such a smart way that it tastes like pork. So if you want to eat it, for example, what does pork taste like? It's from a plant base and it tastes. So that's another little tip I want to just let you know or mention that while we're discussing this. So like I said, you're already your taste buds are starving for food because everyone tell you don't eat sugar, and avoiding sugar is very hard. Just going to just not have anything at all is very hard. So as you come, if it's running in 400s, then you definitely need to look at your medication. And one of the things that is important is there is a certain limit where oral medication help, after which you need injection insulin therapy, and that is something that needs a specialist to control. So you absolutely need some people to do that, which is also very relevant because endocrinologists and stuff can help you with that, and titrating your medication is very important. All right, so that's Jannah, another little tip to add. It's a skill, and we'll go over medications and stuff next time. I just want to say thank you everyone for attending. It's important that we all get a bit of knowledge. Jannah and Vajia are gonna send the assessment form as well, so do have a look at that. The second thing that is relevant, we're trying to invite a friend, a physician who has just come back from Gaza, and he wants to show us eyewitness experience, and I thought it'd be relevant. We're gonna do it in the second part because some of the stuff he has is very explicit, and if you don't want to attend, that's going to be very optional. It's like an optional thing, because the second part, what I saw, I don't think everyone want to handle it, but it is a reality. So you can still attend, and if we need to have you guys, you could do either not attend the second part, or if you want to attend, we'll warn you that the content is a little bit gross, because some of them I saw and I thought, oh my God, how is that happening? So we're gonna try to do that as part of our workup. If no one's got any questions, if you have any questions, you know where to find us. There is an email as well. You can text me directly. And other than that, all guys, just remember, thank you very much. That we appreciate all of your you attending, your time and your work, and have a good Ramadan. Okay, so that's important. And lastly, I want to say, just behind the scenes, the team that's working on this, Jeremy, Dr. Hamza, and now Rida Zalika, we're gonna get Iram and other people, Sabah, involved in this. All of them, just thank you very much for facilitating this. It just became very awkward to maintain, but the team have been doing a very good job. So just all of you, just thank you very much. All right, thank you. Have a good evening. Jannah, thank you very much, dear, for such a kind presentation. All right.